in Idaho, the great state of Idaho today, the State Department of Health and Welfare just issued this declaration. You see it says there in all caps at the top, Declaration of Crisis Standards of Care, all public health districts in the state of Ohio. Date of declaration, September 16th, 2021. That is today. Crisis standards of care provide guidelines that help health providers and systems decide how to deliver the best care possible under the extraordinary circumstances of an overwhelming disaster or public health emergency. The guidelines are used when there are not enough healthcare resources to provide the usual standard of care to people who need it. The goal of crisis standards of care is to extend care to as many patients as possible and save as many lives as possible. Implementation of crisis standards of care is meant to be a measure of last resort. Activation of the crisis standards of care means that all other options for addressing resource limitations have been explored. Overwhelming disaster or public health emergency. Again, this is for all public health districts in the state of Ohio. It's for the entire state now. And the declaration they've issued today then explains basically why they pulled the trigger, how they got to this dramatic and absolutely unprecedented point. As we have been reporting in the last few days, it was just over a week ago now, that crisis standards of care were implemented for specific hospitals in North Idaho, including the Coeur d'Alene area. Just the overwhelming of hospitals in that part of Idaho due to COVID was already provoking its own kind of crisis, even in neighboring Washington state. Hospitals and even just individuals were deciding to try to get patients across state lines, trying to get patients into Washington state hospitals when all the North Idaho hospitals got so completely full with COVID patients that they had to officially start rationing care last week. So North Idaho has already been in crisis. That crisis, as Washington state's governor put it, had already become Washington state's problem as it washed over into eastern Washington. But this declaration from Idaho tonight means it's not just the North Idaho panhandle anymore. It's not just that section of the state. It's the entire state. And now we know that the request for the statewide declaration for Idaho apparently came in from St. Luke's Health System. St. Luke's has major hospitals in Boise and in Meridian, Idaho. St. Luke's is the biggest healthcare system in the whole state. And look at what the declaration spells out about what the crush of very sick COVID patients has done there. Quote, the following conditions exist which support activating crisis standards of care. Idaho COVID-19 hospitalizations, largely of unvaccinated individuals, continue to climb to record levels. The massive surge of COVID patients has exhausted the supply of staff, available beds, and necessary resources to adequately address the increased demand for healthcare services. On September 15th, yesterday, St. Luke's Health System, the largest healthcare system in the state, requested the activation of crisis standards of care in accordance with Idaho law. St. Luke's has opened 93 beds already in non-traditional overflow areas. St. Luke's reported they had run out of physical beds and would be treating patients on stretchers until the additional beds they have ordered arrive. St. Luke's further reported that all traditional ventilators were in use and that they were now using non-traditional ventilators, such as pediatric ventilators for adult patients. St. Luke's had previously canceled elective surgeries, but on September 15th, yesterday, they reported to the state that they had canceled further surgeries, including the removal of low-risk cancers, fractures with pain, and hernia repairs. All of those surgeries canceled as well. Quote, despite taking all necessary measures to prevent crisis standards of care, St. Luke's reported a lack of adequate resources to treat not only COVID-19 patients, but also other medical conditions that may require hospitalization. The St. Luke's COVID-19 patient forecast indicates that in 2 weeks, St. Luke's could have 425 COVID patients, meaning that almost every bed in the entire St. Luke's health system would be occupied by a COVID-19 patient at that point. The largest hospital system in the state says it will be 100% COVID patients within 2 weeks, which leaves precisely 0 beds and 0 resources for anybody who has anything else wrong with them other than COVID-19. The declaration continues at the end, quote, the committee convened virtually on September 15th, yesterday, and recommended to extend activation of crisis standards of care statewide. Statewide. So today, that is where Idaho is. It is no longer just North Idaho, just a few hospitals in the panhandle there. It is now statewide, hospitals and health providers across Idaho being given this set of guidance from the state, this very stark, unnerving guidance on how to ethically and logistically handle not providing health care anymore to patients who need to be hospitalized, but there's no room for them. How to ethically and logistically handle providing some patients with comfort care rather than care to try to save them, because there just aren't enough resources to try to save everyone anymore. Again, the state of Idaho has now legally activated statewide crisis standards for healthcare. It is just a stark thing to see that. To see in the local coverage, to see in the Idaho Statesman the way that paper of record in Idaho has to gingerly spell out exactly what this means so people really understand it. They said today, quote, crisis care standards mean hospitals must prioritize patients differently. Typically, a hospital prioritizes those who need medical attention most and treats them first. When crisis standards are activated, however, health care is given to patients on the basis of who is more likely to survive. If you are less likely to survive, you are less likely to get anything other than comfort care. Idaho's Republican Governor Brad Little is now encouraging Idaho residents to get vaccinated to try to save the hospitals in his state. As we have covered here on the show, though, in recent days, Republican officials across the state seem to have had a real hard time coming to terms with what COVID really is, what it really means, what it is really doing to their state. County commissioners in Idaho's largest health district just this summer fired their longtime nationally recognized health director and instead replaced him with a local pathologist with no public health experience, who apparently is a real hero on InfoWars. He calls COVID vaccinations, quote, needle rape. He says COVID vaccinations must be stopped. He also says you definitely shouldn't wear a mask, Idaho. All you need is vitamin D and horse dewormer, and you're good to go. Don't listen to all these people talking to you about the vaccine and the masks. That's who county commissioners in the Central District, largest health district in Idaho, put on their health board after firing their nationally acclaimed real doctor for having had the temerity to go along with federal guidelines about how to actually prevent COVID. If you are watching this tonight in Idaho, I've been looking at your local press all day, and I know that this is a scary day. I am sorry for what the state and specifically your health providers, your doctors and nurses are going through right now. I hope this crisis does not last. We all do. Idaho has one of the lowest vaccination rates in the nation, which is why this is happening. Perhaps this crisis will be the shock that turns those numbers around in terms of vaccination and thereby saves the hospitals. We shall see. But the situation in Idaho right now is a story of national significance. It deserves more national attention and thoughts and prayers for the people of Idaho, and again, particularly for the healthcare providers there, who are in a place they have never been before, and they don't know how long it will last.
The other major news this Thursday night, the Department of Homeland Security issuing a new warning tonight that some heading to Washington for a rally on Saturday in support of people charged in the January 6th riot, quote, may seek to engage in violence. Security now ramping up across Washington, fencing up again around the Capitol, video surveillance now installed. And the new comments from former President Trump tonight, supportive words for those who were there that day. Rachel Scott on the Hill tonight.
Tonight, the fencing around the U.S. Capitol is back up. Washington bracing for Saturday's rally in support of those charged in the January 6th riot. The Department of Homeland Security tonight issuing a bulletin that people either involved in or opposing this weekend's event may seek to engage in violence. Most Republican lawmakers trying to distance themselves. The Senate's #2 Republican telling the New York Times, there are a lot of clearly angry people who want to march on the Capitol. I haven't talked to a single Republican up here in the Senate that has encouraged or enabled anything like that. But today, former President Donald Trump sending this message. Our hearts and minds are with the people being persecuted so unfairly relating to the January 6th protests. It was not a protest. It was a riot. But for months, the former president trying to rewrite history.
And they were peaceful people. These were great people. The crowd was unbelievable. And I mentioned the word love. The love The love in the air. I've never seen anything like it.
We're coming for you!
As the pictures make clear, that is just not true. The Justice Department reports approximately 1,000 assaults on law enforcement officers during the insurrection. Officer Daniel Hodges crushed in a doorway.
Man seized the opportunity of my vulnerability, grabbed the front of my gas mask, and used it to beat my head against the door.
Officer Michael Fanone grabbed, swarmed, and tased.
I heard chanting from some in the crowd, "Get his gun," and kill him with his own gun.
And Rachel Scott with us live from the Capitol tonight. And Rachel, more than 600 people facing charges, I know, in the January 6th riot, and 60 are in jail tonight?
Yes, David, and supporters of this weekend's rally call those rioters still in jail political prisoners. But prosecutors have been clear about this. They say many of those who are still behind bars pose a significant, credible, and ongoing threat to public safety, David.
All right, Rachel Scott tonight. Rachel, thank you.